So good evening. I am Dr. Sandeep Govil. Today we'll discuss about the clinical cases in psychiatry, and we so we now yes. So we though have a topic of the factitious disorder and the personality disorder. So we just will discuss some of the MCQs for that series to understand the case. We may not have that. Oh my God, so many students joined. Hello, Dr. Saab. So the topic has been actually some issue. So I am Dr. Sandeep Govil. Have experience of 15 years of teaching in psychiatry for PG exam. I have been, so this is about the brief about the us at the Unacademy platform. So we have Plus subscription where we have daily live classes, structured courses, live test and quizzes. I am good, Dr. Saab. Thank you so much. Happy Choti Diwali to all of you. Ali Saab, good evening. Live test and quizzes, unlimited access to the course. We here have the iconic subscription with us at the platform of Unacademy, where you can get the best of the Unacademy and the best of the preparator at this platform with the live classes and the batch courses or the Unacademy and the video lectures and the question bank of the preparator. So we have light test and rapid revision courses. Also we have a T20, though the T20 is over on the floor, but we have a T20 for the NEET PG and the 22 and also for 21. So we have a live test every day at 9 p.m. for 2022 and for the 2021 at the 8 p.m. Also we have a free live classes of psychiatry on the platform of Unacademy every Thursday, Saturday, Sunday from 10:30 p.m. to 12 a.m. and YouTube session every Tuesday 10:30 p.m. But this month, because the clinical cases are too much asked, so we kept, thank you Dr. Saima. So we kept a Friday also 10:30 p.m. a session for the clinical case discussion. That is how you can download the Unacademy app from the Google Play Store. Unacademy Learning app, open it up. We have a NEET PG subscription of Plus or the Iconic. So you can select on 6 months, 12 months, 18 months, and Iconic will be for the preparator plus the subscription of the Unacademy. You apply the code NPG10, you will get a 10% discount. On every plan, we'll have a discount. So that's all about us. So we start with the question which has been asked by many times. So factitious will take up next time, maybe next Friday, factitious and personality questions. So this answer is, question to this answer to this question is, which drug it is likely to be, Dr. Saab? बताइए. A patient on treatment for psychiatric disorder takes overdose of a drug, develops bradycardia. नहीं खान साहब. It is not lithium, Dr. Saab. There is a hypertension, decreased sweating and salivation. Well done, Dr. Thapa and Dr. Anis K. It is a amitriptyline. We know it is a tricyclic antidepressant. It has action on the action like a SSRI, action like a SNRI. So it has all the action on the selective serotonin reuptake inhibitor, serotonin noradrenaline reuptake inhibitor. If you remember, this question has been asked at multiple platforms. We have to know the basic that there is a drug called TCA, and we know that overdose of TCA causes death by cardiac arrhythmia. It causes death by the cardiac arrhythmia. So, how does it do? There is a widening of QRS complex, for which we can give the sodium bicarbonate. We have the QTC prolongation, for which we have to go for a cardioversion or DC shock. So, if you remember, the MCQ has been asked that first time in the AIMS they ask you that the patient on depression has been taken overdose of TCA and is brought in the emergency, and there is a widening of QRS complex. What should be done? Answer was sodium bicarbonate. Next time they ask you, the patient has been brought in the altered sensorium state in the emergency, and in the ECG there is a widening of QRS complex and QTC prolongation. Which drug most likely it is to be doing that? The answer was again tricyclic antidepressant. We know, along in the line with learning with this, SSRIs are safe drug. They do not cause that. Overdose of this lead to serotonin syndrome. Overdose, if given with the MAO inhibitor. Overdose, if given with the monoamine oxidase inhibitor, will lead to a serotonin syndrome. So no deadly one, and the drug is the. So this is the question asked in the PGI, that patient on SSRI, which of the following drug may precipitate the serotonin syndrome? The answer was salicylic or phenylgene. So they are the the MAO inhibitors. We know it's a triad of cognitive. Serotonin syndrome is a triad of the cognitive, autonomic and neuromuscular symptom. You can suggest what topic you would like to learn tomorrow and on Sunday 10:30. Any topic you would like to suggest, you can suggest in this platform. We have not scheduled yet. We have planned to schedule the NEET PG previous year questions. Cognitive is the anxiety, delirium, hypomania and mania. Autonomic, we have the increased sweating, diaphoresis, increased pulse, increased BP, increased respiratory rate, and so on. We have the myoclonic jerks. That's up. Sorry, we have kept a topic to be discussed as a we planned that we'll discuss only 4 MCQs of factitious disorder and personality disorder. Today, तो अभी तो डॉक्टर साहब we are doing MCQs only of the clinical importance. Okay, and we say drug of choice. This is the cyproheptadine. So psychiatric drug will keep it for Sunday. 1.5 hour we'll learn about all the MCQs of the psychiatric drugs. ठीक है डॉक्टर साहब. अभी तो डॉक्टर साहब you have to bear with us for the MCQs which we have brought for you. पेरियोटी क्या होता है डॉक्टर साहब? प्रायोरिटी वाले क्वेश्चन का प्रणाम गुरुदेव डॉक्टर साहब. जय जय जय. So this is clear. So drug of choice is cyproheptadine, nothing dangerous about it. Now let's do this. It's again a very very simple clinical question, but most of all go trap of this question. I am requesting to suggest me some topic for the tomorrow's class. We have 1.5 hour psychiatry class schedule. I planned I would take a NEET previous year questions. Any topic you have in your mind, you can suggest me. 10:30 to 11, you can download the 10:30 to 12 actually. You can download the Unacademy app and enjoy about. In 90 minutes, we plan to do about 80 questions. Let's be practical. We scheduled a 86 question in that, but if at all we could do 80, that's also a wonderful. बताइए डॉक्टर साहब. So this is a man actually suffering from a compulsion secondary to the obsession. It's a compulsion secondary to the obsession. So but it is basically we all go by the words and we may say the answer as D. But the answer basically it's a compulsion secondary to the obsessive thought. ठीक है डॉक्टर साहब. Clear? Nobody for question? Okay. डेफिनेट सिंह जी भी आ गए हैं. वेल डन. सो आइए डेफिनेट सिंह जी कल दिखाइए ऑन द लीडरशिप बोर्ड योर नेम. नाउ दिस इज अ 1 month after the mother's death from a heart failure. The lady is very sad and tearful. She has difficulty in concentrating and falling asleep at night and has lost 3 kgs of weight in last 1 month. She also said to the God, please kill me. I should be dead in place of my mother. Dr. Sharma say it's a uncomplicated bereavement, but we must notice that there is a sadness of mood, tearfulness, difficulty concentrating, sleep issues, also lost 3 kgs of weight and saying to God to please kill me. डॉक्टर साहब ये नहीं करो आप, ये गलत बात है. सैनी साहब डी नहीं होगा. डी तो बिल्कुल भी नहीं होगा. देयर इज अ कंफ्यूजन इन दिस क्वेश्चन बिटवीन दी डिप्रेशन और दी uncomplicated bereavement or what is called as the grief. Yes. देखो डॉक्टर साहब आई थिंक वी डिस्कस्ड ऑन द प्लेटफॉर्म लास्ट यूट्यूब इफ रिमेंबर. लास्ट यूट्यूब ऑन ट्यूसडे it was last special class I think it was on the dissociative disorder. We have learned, see why it is not depression. First of all, because we know that symptoms of depression after death of a loved one till death wish, not able to take food, not going to the work, crying, is grief reaction. जब तक आदमी खाली भगवान से मांगता रहता मुझे मौत दे दे, उससे अच्छा मैं मर जाऊं. Till that time the answer is normal grief reaction. But if we have a when it is depression, कब होता है depression का मरने के बाद? Somebody become active suicidal attempt. गिफ्ट नहीं है डॉक्टर साहब, ग्रीफ है, ग्रीफ. गिफ्ट लिख दिया क्या मैंने? सॉरी, इट्स अ ग्रीफ रिएक्शन. ओके. So active suicidal attempt. Somebody making a Diwali gift is tomorrow. We'll enjoy the 90 MCQs. Okay. We'll enjoy the previous year's 90 MCQ of NEET PG, and gift will be that I include around 40 most predictive question, and let's see how much of that 40 comes up. Okay. So last 40 will keep the most predictive MCQ, which may be asked because of experience, I can tell. So just a joke, but that is a gift I can give you tomorrow. 90 MCQ in 90 minutes on the special class of NEET PG previous year questions, 10:30 PM. So we remember that we have a special class just to thought again once, every Thursday, Saturday, Sunday, 10:30 PM to 12 AM we have a special class. This month we have a YouTube session 2, Tuesday and Friday 10:30 PM. On Tuesday we do take up the MCQs, and on Friday we'll take up the clinical case study. Free class, yes, but for that you have to download the Unacademy learning app. You can enjoy Psychiatry every Thursday, Saturday, Sunday free on the platform of Unacademy. प्रायोरिटी वाले भी करा देंगे डॉक्टर साहब. प्रिडिक्टिव एमसीक्यू आई से, नॉट प्रायोरिटी, प्रिडिक्टिव, जो आएंगे आ सकते हैं. तो somebody making an active attempt to suicide, somebody displaying a anniversary reaction, somebody Unacademy app, डॉक्टर साहब will tell you how to join it. A simple Unacademy learning app. You can enjoy the Psychiatry for free, and you can also join us to enjoy the learning of not only Psychiatry but all the subjects. We are revising all the subject within say about 1 month. So we are starting an intensive batch course. We are starting an intensive batch course starting from 20th November. In 1 month we will revise all the subjects. Psychiatry this time give the 10 hours to revise the Psychiatry, starting from 28th November to 3rd December every morning. So active attempt suicide, anniversary reaction, somebody having a excessive guilt, and then somebody have a mummification, like freezing the belonging of a loved one. Freezing the belonging of a loved one. That's a indicating of a depression. Okay. That's up. Let me clarify who talk about PTSD. See, PTSD is a symptom cluster after a traumatic event, which has 3 components. First is the repetition of the event. Another is the emotional reaction to it. Third is the avoidance. So car bomb blast, my whole family blown off in air in front of my own eyes. I have a illusion of those. I have a illusion of those, I have a flashback phenomena for those car bomb blast. I have a repetitive dreams and reliving experiences. ठीक है डॉक्टर साहब. And what is the emotional reaction to it? I am in a shocking state, I am in a numbing state, and I am hyper alert. ठीक है डॉक्टर साहब. I never go to temple and never buy a car. So that is what is the post-traumatic stress disorder. ठीक है डॉक्टर साहब, क्लियर. सो PTSD में ये 3 कॉम्प्लेक्स कॉन्सेप्ट आएगा. वी नो less than 1 month after car bomb blast, it is being called as acute stress reaction. For more than 1 month, it has been called as PTSD. More than 6 months, same thing will be called as the chronic PTSD. ठीक है डॉक्टर साहब. लेकिन अब यहीं पे हम क्वालिफाई करते हैं. चलो, विल लर्न व्हाट इज द ग्रीफ में क्या होता है. सी, इन ग्रीफ विल हैव अ, व्हाट इज ग्रीफ? Grief, we have a normal emotional reaction to loss of loved one by process of death. WhatsApp, you can do me on this number, or you can join my Telegram channel Psychiatry Made Easy, or I can join you to the if you WhatsApp me on this number, I can make a group. You can make a group. I will post the upcoming classes, free classes of psychiatry, the quiz of psychiatry. Okay. Okay. So, and psychiatry Telegram channel is the Psychiatry Made Easy. So in grief what happen? Grief में क्या होता है डॉक्टर साहब? 3 stages. Shock and denial. No, this can't happen. He or she can't die. Yesterday only we have drinks together. How can he or she be die? Then there is a distress. I am crying all time. I am troubled by all time. I am not taking food, not going to the work, always crying, God, why you do this? Why you would have taken me? I feel as if she is here. ऐसा लगा उनकी खुशबू आई, आवाज़ आई, जुल्फ लहराई, दुपट्टा लहराया. That's a normal distress of the grief. Will that have on Sunday? So 60 MCQ will do that on Sunday, 10:30 to 12 AM. Then there is a detachment. That is what is the grief. Clear? So grief is after death of loved one. 3 stages: shock and denial, distress, and ultimately detachment. And we have seen how to differentiate from the grief and the depression. These are the points any symptoms of depression till death wish. Sadness of mood, lack of interest, not taking food, lost weight, saying to the God, please kill me. Till here we will call it as a normal grief reaction or bereavement. But the moment somebody make a active attempt of suicide, it will be called as the depression. ठीक है डॉक्टर साहब. Now next is the, let us clarify here, is the adjustment disorder, because ये सब confuse होता रहेगा बार बार. We know in adjustment disorder, it's a illness which start within 2 weeks to 3 months of stressful event. and should resolve by its own within 6 months. Dabda is after the Dabda कब होता है ये बताते हैं डॉक्टर साहब को. Dabda is a stressful event के बाद. मरा नहीं हूं, कैंसर हुआ है मुझे, HIV हुआ है, डॉक्टर ने कहा HIV हो गया. आफ्टर अ reaction to the stress, no, I can't have cancer, no alcohol, no cigarette, how can I have a cancer? Anger with a God, why me? My friends are doing that, they're all doing that, and why cancer me? It's a anger, denial, anger, and no problem. Some ill deed in last birth, some ill deed in this birth, probably that is why I become cancer, and I have a depression. I feel depressed because it, and ultimately I accept destiny. It's a acceptance. So Dabda is after the stressful event. ठीक है डॉक्टर साहब. Dabda is Kubler-Ross staging after a stressful event. ठीक है डॉक्टर साहब. Now next we come on to the adjustment disorder. So we know that after the lady attempts suicide, after she come to know that husband has left her and married another lady. She is crying, she is distressed, she is not able to sleep, and she slashed her wrist to end her life. Answer is the adjustment disorder. We know it is of 3 types: depressive type, anxiety type, and the conduct type. Depressive type, anxiety type, and the conduct type. What do you mean by type? Symptoms are sub-syndromal. So symptoms are of a depression, that sadness of mood, she slashed her wrist, but it is a reaction for a normal stressful event in the life. Husband has left her. Now there is a doubt you will have later on, that we remember PTSD is after is also stress, and this is also after stress. What is the difference in the stress of both of them? You remember the example of PTSD? Car bomb blast, my whole family blown off in air in front of my own eyes. And that scene again and again repeats in front of my eyes, and shocking, numbing I am always. You tell this example now to 1,000 ladies, 1,000 people. Out of 1,000, 99.9 will say, Dad whatever he is experiencing, had I seen the same phenomena, I would have experienced the same phenomena. It's a objectively high stress. You remember the example of adjustment disorder? I tell you very fastly. Lady, husband has left her, she is crying, she is distressed, she is not able to sleep, and she slashed her wrist to end her life. It's an adjustment disorder, depressive type. But now you tell this example of the lady, husband has left her, to 1,000 ladies. Out of thousands, some will say, let him go to hell. If he is not bothered about me, sorry, I am also not. Some will say, I was knowing about their affair for last 2 months. I was just waiting for a pistol to come. It's good they ran away, otherwise today my pistol has been come, and they would have been killed, I would have been in jail. Other lady will say, sorry doctor, my time is very precious. Such a nonsense man. I don't want to waste my time for a single moment. So, out of 1,000, nobody committing suicide, though murder done by many. So, it's a how I perceive the stress. Subjective perception of stress. So, today we learn the basic concept of the differentiating between the adjustment disorder, PTSD, acute stress, chronic PTSD, and the grief. So, we know again this is a history paradigm, and the answer is a lady with a sadness of mood, palpitation, loss of appetite, and insomnia. There is no complaint of hopelessness and suicidal ideas. She is able to do her work normally, and her life is also normal. Diagnosis is mixed anxiety depressive disorder. So there is a sadness of mood. We know what this disorder is. Very good, Dr. Thapa. It's an illness in which symptoms of both depression and anxiety are present. None predominates and none sufficient for independent diagnosis. So very good, Dr. Saini and Dr. Thapa. It is a mixed anxiety depressive disorder. Some guide they say the answer as a dysthymia, but the rule in psychiatry say when we have a autonomic symptom of anxiety, the diagnosis of anxiety disorder has to be made. ठीक है डॉक्टर साहब. Now last question to conceptualize. A 25-year-old lady presenting with a sadness of mood, lack of interest, crying spells, insomnia for last 6 months. There is also she is not able to do her work normally, and social life is also not normal. She now complains of hearing third person auditory hallucination for last 15 days. Well done, Dr. Definite Singh. So this question, you remember, has been asked twice in AIMS. Now the answer is, well done, Dr. Thapa, Dr. Saini, Dr. Definite Singh, and Dr. Nikita. Very good. If I tell you why it is not schizoaffective disorder, third person आवाज आ रही है, डिप्रेशन भी है, why it is not the schizoaffective disorder? Same question had it been asked like that for 5.5 months. अगर यही सवाल ऐसे आता, same question, and she is now hearing voices for 5.5 months, the answer would become, answer would be, last question, Dr. Sahab. Answer would be B. देखिए, what is schizoaffective disorder? The schizoaffective disorder, ना डॉक्टर साहब ए नहीं होगा, स्किज़ोफ्रेनिया नहीं होगा डॉक्टर साहब, दोनों हैं. लेट अस डू व्हाट इज schizoaffective disorder. We say it's a illness in which symptom of both schizophrenia and mood symptom occur simultaneously for most of time of disorder. So we see it is simultaneously happening, but for the most of time, that is 80% time. So when in the question I am having the hallucination for only 15 days, the answer was depression with psychotic symptom. When the same question has been asked to me and I am hearing the voices for 5.5 months, so symptom of both of them is there, but it is for the schizoaffective disorder. Clear, Dr. Sir? So thank you so much for today, and we see you on the tomorrow's class for the NEET PG session. The best way and simplest way is to download the app. This is the way, as somebody is asking. Very simple it is. Go to the Google Play Store, download the Unacademy Learning app, open it up. There will be a section of NEET PG Plus or NEET PG, the iconic subscription. So you can click on iconic or plus for whatever duration you want. And if you apply my code Dr. Sandeep-YT, you will get discount of 10%, or any code you wish to apply. But please do apply my code and enjoy the learning. You will be anyway same, discount will be same, topics will be same, only I will get some name and fame. So that's a discount of 10% we all offer to you. So join us and enjoy the learning. See you tomorrow on the 10:30 p.m. and on Sunday 10:30 p.m. for the marathon of MCQs. So thank you so much. Good night. All the best. Keep coming to the platforms. Enjoy learning subjects with us.